The title of this course is Energize Your Practice. Now, that can mean a number of different things, and in fact, it will mean a number of different things throughout the course. So, one of the things would be, how do you take your practice and make some changes to it that make it much more enjoyable for you, your patients, and allow you to be able to maximize the profits that you can make out of your practice, where you're not going to be any longer bound or in a box, if you will, by the medical establishment. The other side, though, is actually pretty interesting, that over the last 100 years or so, we've experienced what could be termed chemical medicine, where everything has to do with a chemical makeup. There are a few devices and things on the market that we all know about that use electronics, but for the most part, the opportunity to use the body's own energy either to diagnose it or to heal it has been dismissed or not taken in a manner that would be consistent with the value that it can produce. So this course will focus on that as well. So Dr. Cowden, could you just explain a little bit about how that actually works?
Yes, we're talking about energy medicine. We're talking about the fact that the body is not just a bag of bones or a bag of chemicals, but it's a very sophisticated electromagnetic instrument. And on the body, there are nerve terminals that connect with the autonomic nervous system. That's the sympathetic and parasympathetic nervous system. And if a person experiences a stress, then there will be a change in their autonomic nervous system in such a way that it changes the electrical conductance on their skin. Most people are familiar with the lie detector test. You hold an electrode, or you have an electrode attached to you with an adhesive, and then you hear something said, and you either respond in a negative way or neutrally or in a positive way. The same thing is true not just with an auditory stressor, but also with a frequency stressor. So if we expose a patient to a frequency of some type, an energy, if you will, and that person then has a distressing response, we know that frequency represents something that probably would not be good for them. If they have a beneficial response, their galvanic skin response improves, we know that substance is something that would likely benefit them. If they have no change at all in the galvanic response, we know it's probably okay, but not likely to be very impactful as a treatment for them.
Okay, so the pathways that go through the body are well accepted. Obviously, some of them are, everybody would know. Your body is a bag of bones, but it also has a bunch of nerves in it.
Right.
And those are the main pathways by which we actually do many things. I mean, if we didn't have those pathways, we'd be able to move our body, our muscles, nothing would work properly. And certainly we wouldn't be able to get the connection to our brain as well. So it seems to me that there is a combination between this medicine, this type of medicine, and then also the chemical. There's a benefit in both ways that can help the patient. Is that in your experience as well?
Well, yes. I mean, in this type of medicine, in the integrative medicine, we use chemistry to our advantage. We evaluate patients with chemical blood tests or with chemical tests from other body fluids or body tissues, but we also evaluate the patient with the energetics of their body. Looking at the galvanic skin response, for example, that we talked about a moment ago. And in addition to treating a patient with a chemical, we can actually treat a patient with an energy, with a vibrational frequency, whether that's from a device that puts that energy in with electrodes on the skin, or whether it's from a device that has a tube that broadcasts that energy into the environment around the patient, or whether it's from a liquid substance that has the energy imprinted into it or diluted into it, if you will. So that goes back to the concepts of homeopathy. Homeopathy's been around with us for a long time. Dr. Samuel Hahnemann in Germany in the late 1700s came up with the concept of homeopathy. He said, he found basically that if a person had the symptoms that were similar to a person that had exposure to a toxic substance, if he gave them a dilute enough amount of the correct dilution of that toxic substance, that the symptoms of the patient would go away. So he was using like, treating like. So the symptoms that the person that they presented with were similar to a person that had been poisoned with something else. For example, arsenic is a very toxic substance when you give a large amount. But then whenever you give a very dilute amount, you can actually cure a patient of the symptoms that are similar to the arsenic poisoning.
Yeah, you didn't mention the photonic as well, but that's a key ingredient in some of the treatments as well. And as we go through the course, I think you're going to be talking about some of those different things that you use in your practice. Right. What we're going to be covering in addition to that is we're going to go back and give a history that's actually not centuries old, but millennia in energetic medicine. So this is not something that's just happened overnight, but on the other hand, some advances have happened in the last 50 years that have been tremendous, and every year more and more things happen to bring energetic medicine to the forefront, if you will. So it would be wise of anyone who's practicing medicine to start getting an understanding of how these things work and not dismiss them just because they don't know anything about them. We're also going to include some things about how you can move a practice from being so totally based in the government and in insurance companies that you're in a box, you can't do what you'd like to do, to move out of that box and start learning how to do more cash type of a practice. We'll also discuss some marketing ideas and marketing techniques. We really want this course to be a way for you can take the practice you have and energize it and make it, just turn it on, if you will, and make it much more fun and much more profitable, and at the end of the day, much better for your patients, clients. So thank you, and we're going to proceed now into the first segment of our course, which will be homeopathy.